he's across the way with our program this morning.
Thank you, Steve, and good morning. And we've got some folks from Regional West Medical Center here today. This will be an interesting show. We're going to talk about trauma services up at the hospital, injury prevention. We have Dr. Rommie Hughes, who is in that emergency room quite a bit, and also Shermaine Sterkel. She is the trauma services coordinator up at Regional West Medical Center. So we're going to have Shermaine talk first in regards to exactly what trauma services coordinator means at the hospital, and then we'll have Dr. Hughes explain what he does.
Well, as trauma nurse coordinator at Regional West, I have a responsibility to oversee the delivery of the trauma service from pre-hospital clear through the hospitalization to rehabilitation. And I work closely with all the various departments, the surgeons, the ED, the nurses, and the families. Do multidisciplinary trauma team rounds. Trauma services is a team sport. You need all your pharmacy, therapy, social services, along with all of your physicians and nurses and everything.
So you're kind of the coach, huh?
Cheerleader.
Cheerleader, whatever. Is that? I don't know exactly. It sounds like you're kind of like an assistant coach or whatever. Maybe Dr. Hughes is here as the coach. I'm not exactly sure,
He's
but
the coach.
He's the coach.
Yeah.
I don't know if I'm the coach or not. Maybe Shermaine's the offensive coordinator.
Yeah,
or something like that.
Something like that. But okay, so Dr. Hughes, you are there when the patient comes in, right?
I am. I'm actually the medical director of trauma services at Regional West, and the role of Regional West is throughout the state of Nebraska, the hospitals are designated certain trauma levels. And
right.
The smaller the hospital, the lower the designation. And within each region of the state, there's a lead hospital. In our region, which is Region 4, Scottsbluff is Regional West is that lead hospital. And so our role as an institution is to educate all the outlying providers to make sure they're up to date on the best trauma care that they can deliver with the resources they have at their institution, and then facilitating them getting the sicker patients to the level of care that they need. So that's what we do as an institution. The surgeon's role at the hospital is we kind of direct all the care of the trauma patients as they come in. And when somebody gets injured out in the field, the EMS people will obviously assess them and see how sick they are. Depending on how sick they are, they classify them. The very ill patients get a full trauma team activation, and then the whole cadre of people are waiting for the patient when they get there. The surgeons, anesthesia, OR, CT scan, blood bank, and those types of things.
Okay. As a Region 2 trauma hospital, that means that you guys are serving a wide area, not just western Nebraska, doesn't it, but also eastern Wyoming?
We do, and with our helicopter, it gives us a large catchment area. Our helicopter goes all the way Valentine north, east as far as Ogallala, south Grant, sometimes Imperial, Julesburg, Colorado. West not so much because of Cheyenne in the Front Range, but mainly to the east, the south, and the north. And we have an catchment area of probably a couple 100,000 people.
Yeah, I was going to say you're serving a wide area. We're not just talking here, Scottsbluff County and the immediate counties around here. It's a wide vicinity that Regional West serves. So this is National Trauma Awareness Month.
Yes.
And Shermaine, maybe have you discuss what you guys are concentrating on, although we're going to talk about some other things as well. But you guys are really talking about accidents on the road, distraction when folks are on the road, and just kind of staying alive when you're out there, right?
Well, the focus this year for National Trauma Awareness Month is about distracted driving, and the theme or the logo is Drive, Arrive Alive. And distracted driving, we all have had that happen, and I think so many times we focus on the young kids, but we as adults also, I'm guilty myself of distracted driving. Our number one cause of injury is falls, and then motor vehicle crash is next. In following that would be our ranch or livestock related injuries. This is big right now. We got brandings going on, and we got the farmers out in the field. We've had horse related, cow related, ATV related with the farm. A lot of times it's not recreational ATV, which there is, but there's also ag related. It's their machinery.
Yeah, and it's all ages. It's not just young folks.
1 to 90.
I mean, you've had folks in that were up around their 70s or 80s
on
from
ATVs
farm
and
accidents,
horses.
right?
Yes.
Yeah, so it's very serious situation regarding that. Now, when people have, say, a serious injury from a fall or an accident or something like that, Doc, explain how that works. What happens when you guys first get the call, and how that situation sets up at the hospital?
Well, usually the EMS arrives on the scene and they assess the patient, and then they call the ED and explain the injuries or the suspected injuries, and then they classify them a partial trauma team, which would be not such a severely injured patient, to a full trauma team, which is those patients who are hemodynamically stable and have the highest probability of having very significant injuries. So when those patients come to the emergency room, they're greeted by a bunch of different people, and we try to approach every trauma patient systematically. And so if somebody comes in with a severely fractured leg, you don't get distracted by the fractured leg. You have a systematic way to go through that patient so injuries aren't missed. And we always try to talk about every patient has every injury, and our job is to rule out, we have to suspect they have every injury, and our job is to rule those injuries out one at a time, starting with the most life-threatening injuries first.
Yeah. So you go through that, and then once they get through that, then do you determine where, obviously, whether they need surgery, those type of things. I was looking at a thing on television the other day where they talked about what happened when Juan Nicasio got hit in the head at Coors Field, one of the pitchers for the Rockies, and he got taken to the emergency room in Denver, and all the things the doctors had to consider when he first got there. And it sounds very much like this, where you determine first of all the seriousness of the injury, and then I guess one of the things they have to do right away is determine whether surgery is needed.
Exactly.
Am I right?
Exactly. The first thing you do is, based on the patient's hemodynamic status, if they're very injured, they don't get any imaging studies such as CAT scans. They go right to the operating room, because usually they're hemodynamically unstable because they're bleeding someplace, and you have to stop that bleeding, and that has to be done with surgery. Those patients who are hemodynamically stable, all those patients usually go to CAT scan in this day and age, and they get the bodygram, and then based on what the CAT scan shows, depends on where they may need to go. With trauma injuries now, most things are treated non-operatively. People who we used to operate on for splenic injuries, liver injuries, kidney injuries, even some brain injuries, we're watching those conservatively, and those patients with optimal medical care will go on and do okay. So we're operating much less in trauma than we used 2 years ago, and that's good for the patients.
Yeah. All right, let's take a break. We'll be right back. All right.
Quick little sidebar here. We have a patient who's going to be on a television commercial soon. He was from Rushville, I think, and Shermaine and some of the other people up there actually coordinated a party to bring the football team from Crawford down, so that he could have a pre-football dinner.
Yeah.
His mom was killed in a wreck.
That's the kind of
5
stuff
seconds.
Yeah. Okay. We'll talk about it.
It's treating the whole emotion too.
All right, we are back on News Extra. Really interesting conversation with Dr. Rommie Hughes up at Regional West Medical Center, and Shermaine Sterkel, who is Trauma Services Coordinator. And so part of it, obviously, once there's the surgery and the recovery and all that kind of stuff, and the person gets back up to a regular room, and then they're working toward rehab, that is where you also come in, don't you?
Yeah, I follow them through the whole continuum of care and work with, the nurses and physicians and families, because, this is a time where these families are just devastated. Their whole life has changed. And so at that point in time, you need to constantly get them, clinical psychologists. You have to deal with grief, survivor guilt, post-traumatic stress, and just their whole life is turned upside down as far as maybe not returning to their job, their school, their previous life. And so there's a lot of that we deal with, and the whole team works with that.
Yeah. And if there's, like we were saying here during the break, if there's somebody like that has team members or friends or whatever that come in and visit them, and you're looking for ways to cheer people up. That's kind of
it's really
some of the
important
thing.
because it's not just people's family isn't necessarily blood. It's their friends and their acquaintances. So it's really important to get them involved with their recovery.
All right. Doc, injury prevention, what would you suggest as we go into this summer season? When I'm on the golf course, I need to watch and make sure I'm out of the way of everybody's golf ball or whatever. But what else do we need to do?
Well, I'm not sure you have to wear a helmet on the golf course.
Yeah, exactly.
Depending on who
Well,
you're
you haven't
golfing
seen
with.
my
You don't know who you're
game, you
golfing
know.
with,
So
it's just fairly common sense stuff. Riding a motorcycle, helmets make a huge difference. In the car, seatbelts make a huge difference in saving lives. If you're in a
get those seatbelts in correctly too when you're putting children in.
Exactly. Make sure the car seats that you have for your children are of appropriate grade and that they're fitted right for the car. If you're in a situation and you're a young kid and you're faced with having to get in a car with somebody who's been drinking, you just got to make the right choice that you're just not going to do that. And on the farm is very difficult because we all know farmers work hard and they're not always the most open to injury
Well, they've
prevention.
always done most of this stuff a number of times.
Exactly.
So it's kind of easy to say I've done it before, and you get kind of laissez-faire about the whole thing.
Exactly. But with our injury prevention, I think people are becoming more aware. I know the manufacturers of farm equipment are becoming more aware of injuries and starting to put devices on farm implements that can't be removed by the farmers themselves that help protect them in the field as well. The other thing I might mention is one of the important things about trauma is after the patients leave the hospital or go to rehab or whatever, we review every chart. And we have meetings with all the physicians involved to try to review how we took care of that patient. Is there ways that we can do it better? And that's one of the good things about trauma is that we review every case and we try to get better on a daily basis.
And the hospital usually sends out a survey to the patient too as well that you ask them to return. I mean, take some time and return that survey, right?
We do. And at Regional West it's great because everybody's involved in the trauma service. Everybody takes care of the patient. Everybody really has a stake in how these patients do. And it's just fun to work in a team environment like that.
All right. Thanks, you guys, for coming in. We appreciate it
Thanks
very
for having
much.
us.
Thank you very much.